start.
Thank you, Dr. Shupriyo, for introducing me. So at this point, brief introduction about me. I am Tahmid Kashim, and I completed my MBBS from Dhaka Medical College in 2012. And then I worked 2 years with ICDDRB as a study physician. And in 2016, I started my program with the University of Alberta School of Public Health. And my program was um, Masters in Health Policy and Management. And in 2018, I graduated, and in 2019, I joined Alberta Ministry of Health as a policy analyst. And then I have been working there until now. So I'd like to first introduce you about CRIDA, and then go into our speaker and our participants, and then into our discussion format. So I would like to request Dr. Nazif to start the presentation at this point. Thank you. So can we go to the next slide, please? Okay, so I think everyone knows about CRIDA, so I want to talk briefly about what it does and what it is. So CRIDA is a volunteer research-based organization that identifies events of public health interest and makes meaningful contribution to Bangladesh or any other nation through knowledge translation activities. So the main objective for CRIDA is to raise awareness on important health and social issues, which CRIDA does through developing and disseminating infographics, videos, writing articles and newspaper, as well as developing policy briefs and fact sheet. So currently we have different kind of research projects, such as projects on COVID-19, vaccine development plan, antibiotic resistance, but we are expanding to include other research and policy development project as well. The secondary objective, if we say, is to provide experiential learning opportunities to CRIDA trainees and equip them with public health competency, such as communication, leadership, project management, networking, facilitation, and presentation skills. So the main objective of this is to develop soft skills and transferable expertise necessary to become a skilled public health candidate. As part of the process, we also arrange different public health career talk programs to provide information and support prospective candidates to take informed decisions. Okay, can we go to the next one? Thank you. So before going into the program highlights, I want to speak briefly about our speaker and about our participants. So I, on behalf of CRIDA, would like to thank Dr. Shafi sir for giving his valuable time to participate in this public health career talk Facebook program. Actually, his fame, popularity, and achievements precede his introduction. So being an internationally recognized researcher, Dr. Shafi sir has held multiple leadership and academic positions in both developed and developing countries. He has got significant success in various areas of global public health and education programs, worth mentioning the capacity building training program of internationally trained medical doctors and maternal and child health promotion initiatives. Today, I'd like to say CRIDA is really proud to organize this career talk with Dr. Shafi sir, which we are sure would provide valuable direction and guidance to prospective public health candidates. Now, briefly talking about the participants, we have got overwhelming response to attend the event. Thank you, everyone. Unfortunately, we could not accommodate everyone and would like to encourage to register our upcoming events. We tried to bring a mix of participants from different backgrounds and public health work experience. So we have got applicants from various countries like Bangladesh, India, Pakistan, and Canada, participants with diverse educational background. For example, majority of the participants are from MBBS or BDS background with MPH or MSc degrees, while few graduates have pharmacy, statistics, biotechnology, health informatics, and economics background. Also, we have participants with different years of public health training and work experience. For example, we have participants who are working as assistant professor, lecturer, medical officer, and in different research-based roles, as well as we have participants who are currently in undergrad or postgrad programs. Now going into the program highlights, today's discussion is divided into two parts. The first part is explore Dr. Shafi sir's career journey, highlighting his clinical to research career, education, training, and experience, his struggles and success factors to overcoming the challenges. In the second part of the discussion, we have identified 4 categories. The categories were selected based on our previous Facebook Live events, career talk programs, and information from the Google form that you have completed. So the categories are admission requirements and expectation, career opportunities after graduation, scholarship and other funding opportunities, and potential research areas to secure admission and scholarship. Um, Participants will have the opportunity to ask questions on relevant categories, of course, directly to Dr. Shafi sir, and we will give you the floor accordingly. Now we have talked about the discussion format. I want to speak briefly on some house rules that we thought would be important to mention and keep in mind so that we can successfully conduct the program. So please put your speaker on mute entire time except when you are asking a question. So if you have any problems with watching or hearing, please comment in the chat box. At any time of the event, you have a question, please put it in the chat box and we'll give you the opportunity to ask question to Dr. Shafi sir accordingly. Asking a question, briefly mention your name, educational background, current work status so that we can understand better, and then ask the question within 30 seconds and everyone would get a chance to ask a question. Now at this time, I would like to get back to Dr. Supriya to continue the program.
Thank you, Bhuiyan. It's really an honor for me to host this event. I mean it, I really feeling very lucky. Now we are going to discuss with our respected honorable guest, Dr. Shafi Bhuiyan sir. I would like to tell some information about Dr. Shafi Bhuiyan sir in shortly. Dr. Shafi Bhuiyan, MBBS, MPH, MBA, MJF, PhD, is an award-winning faculty member and an internationally recognized academic and professional leader in global health training, research, education initiatives with diverse experience in both developed and developing countries. After finishing medical college at Sir Solimullah Medical College, Dhaka, he started working as the founding liaison officer of Maternal and Child Health Research and Training Institute in Dhaka, in Bangladesh, where Dr. Shafi focused on capacity building training on health professionals. Following completion of PhD in human science, he worked as JSPS postdoctoral scientist and faculty at Osaka University, Japan. Asian Institute of Health Development, AIHD, Mahidol University, Thailand, University of Health Science, Bangladesh. In 2010, Dr. Shafi immigrated to Canada, where he began a new career focused on how equity-informed approaches can improve both health services and healthcare training. Over the next several years, Dr. Shafi moved to successively more senior positions so that today he is a faculty member at both Ryerson University and Department of Community Services and at the Dalla School of Public Health at University of Toronto. Throughout his career, focus has been on improving the way we deploy and refine global health resources, whether guidelines or training programs to improve health system performance and the equity of health system performance in local and global contexts. Now I'm going to discuss with Dr. Shafi Bhuiyan sir. Sir, how are you and your family?
Thank you. Good morning from Toronto and good evening in Bangladesh. Yes, this is Dr. Shafi Bhuiyan. I'm doing well. I'm so thrilled and excited to see all of our Bangladeshi young professionals like you. Most importantly, I would like to thank Supriya, Dr. Tahmid, and Rosen, and Nafiz, and others to organize the excellent evening with all our brilliant medical doctors or health professionals or young brilliant star. I welcome you this evening.
Dear sir, Many students of our country dream for an opportunity to study in Canada. Most of them want to pursue a master's degree, MPH or MSc in public health or PhD in Canada. But it is not easy to get an admission opportunity in Canadian universities. Every university has some requirements to be fulfilled for admission opportunities. Sir, would you please elaborate us about the admission requirements and admission process in Canadian universities? We'll be enlightened.
Yeah, thank you. Actually, I would like to ask Najib to go to the next slide. And uh, to have a higher education abroad is an important decision to make. So I think today is the historical evening, I think, in ever in virtual history, in Bangladesh or other health professionals meeting virtually with me to learn about this. Let me go back to the 20 years ago or 25 years ago. The journey was not so rosy. And there is nothing out there you can learn that how to go outside of the country to study about the public health because Bangladesh is mostly or developing countries or Southeast Asian country or Middle East fragile state, the health professional a little bit overwhelmed with their own jurisdiction to focus themselves in the clinical journey. But it's very hard. Not so many position is out there available, and our young generation they want to grow, but it was not so easy. That's why I start thinking, start my focus into a community-based or primary healthcare thing to prepare myself. The admission for international universities as a international health or international students capacity, it's very important to prepare yourself first before going to apply. You have to ask yourself, are we ready? So are you ready? So you have a mindset, you determine that you want to go abroad to study. And then everything we do is follow your career path. I think I congratulate and thanks CRIDA to show this path for our young physicians and young health professionals to learn that. What I did, I work in the clinical settings. I found that it's not enough for me to satisfy to treat one patient or five patients per day or 10 patients. I would like to go to the community because that's the best source to learn. So I start my journey actually there in 1994-5. So when I started in the community health to working in the rural level to study, to know about the community, mother and child and family planning, reproductive health, or other communicable disease, non-communicable disease in rural Bangladesh. So it gave me huge joy and pleasure to learn from them. And when I learned within very few, within 2 years, maybe I could say, I got an interest in academia. So I think I should go for study for public health that I have no clue where to go, how to go, when to go, and what to start. It's very challenging actually. So, but we explore finally that going for Master of Public Health in 1999 in Thailand. At the time, after 30, 40 years of our country independence, that only 30 or 40 people get MPH from Mahidol University. And we went there and we learned as a physician, I'm not a complete person. I need to learn about research. I need to learn about communication. I need to learn about management. So I start doing some research work in low birth weight baby. That gave me the foundation. And afterward, other opportunities coming up, work with different setting. One of the important, my experience is, sorry, uh, working in the field and going for university study is a huge impact, meaningful, easy to understand the context and develop yourself. When I finished my MBBS, I worked in the field. Then I went to the MPH, and then I come back to Bangladesh to work in the field. That gave me more capacity myself to believe myself. This is the most important thing that I could do it. Imagine after MPH, I just work with the primary healthcare UPHCP project in urban primary healthcare in city halls. to provide maternity care in urban settings. So this is an example. Then after that, I work in the many project and programs, which is huge, but I want to briefly say that gives me more inspiration to go for study abroad again for PhD, which is the highest level. At the time, I was so young, so I could not find any mentor in Bangladesh, but my Japanese friends, they helped me to get there. Then we designed the research, action research in Bangladesh in maternal child health, how to improve communication for doctors, nurses, midwives, and the people. That gave me 4 or 5 years to learn about the mixed method research, and then I could do something better for the community. That is the first step. So prepare yourself, and then find out your strength, and you start believe yourself, because very rightly, I think you could imagine Dr. Tahmid structured this discussion today in this evening that so much organized way. That is the style of international. If you want to do something and even successful, I'm so glad hundreds of people interested to join me today. But to serve you better, we believe in quality. So some of you are lucky, so you joined today. So and you could see how they started with the house rule and how to proceed, and that's why we are here to give you some tips, who you are, where you want to go, and how you want to go. That's we would like to guide you. As you can see from my earlier talk, that you need to prepare yourself, then you need to have some strength yourself. If I ask you, what is your strength? Many of our young professionals in developing country, they cannot answer. They have a huge strength, but they cannot find what they should say. But I said, don't be shy, be modest. Figure out what is your strength and find out the program and search the program. Don't ask me or other people which program I should go. It's you who is the driver. We are the facilitator. We have the opportunity to guide you. Once you find something, once you see your strength, you just go for it. Don't wait. Don't be afraid about failure. Remember, failure is the pillar of success. And I think this evening, despite of Corona crisis, you joined here, and this means a lot to me. And I think we can learn together, we can grow together, and we can support our community, which mostly needed. As you know, Helen Keller or other people said, meaning of life is service to others. And this is the time, as Albert Einstein said, in the middle of any crisis or any difficulties, opportunity lies. I think this is another example today. We are so close virtually, so that we can speak and we can learn together. And that is my first point. So find out your right strength, and then find out the university you want to go, and then read all the informations there very carefully. Usually all the university give very clear direction. Remember, if you don't understand, don't shy, just send email to them, and or contact the CRIDA or us anytime. So I don't understand this, can you explain? We'll be happy to help you. This is number one rule. So what is the next questions? Supriya, what is the next questions you said? Did I miss?
Sorry, sir. Sorry, sir. I was just muted. My next question, before the next question, I will go to Dr. Tamid Bhaiya if any question arise from the participants. Is there any questions, Bhaiya?
So not now at this point. So I'll let you know if there is anything.
Okay.
Thank you.
Okay, I will continue. So let me give you the story so you understand. So I went to Japan for PhD, and without knowing anything, But my professor was so kind. He is Yasuhide Nakamura. He said, Dr. Shafi, welcome to Osaka University, Japan. We will learn together. And I was so surprised. Such a high-level professor, he said he will learn from me, learn with me, and then we'll work together. So I was never heard this dialogue in Bangladesh when I was there. That is surprising me also and inspire me. And one single word can change my life. And then I start working to learning about the research and style, joining the meeting, speaking with the people, joining the international conferences, and build my expectation where we want to go. That is that is important. And then I finished successfully within 4 years.
Right.
Yeah, so my career journey start in the international health. First, I was international student in Thailand. Then I was international student in Japan. And the most important thing is I was the first international student of my supervisors. They never accept international student before. So you could say I was lucky to have the full attention and time, mentorship. I really admire and thank them wholeheartedly. Then I start my journey in working in Bangladesh to develop my PhD things to to empower women, because I think social development and women empowerment is important. Many of you may know BRAC and other NGOs, they are doing this maternal child health handbook to improve maternal child health capacity in the system. But after that, for family reason, I immigrated to Canada without any plan before. This is the only things has happened. And then I found in coming to Canada, so is a huge risk for people, those who have no research idea and no connections, no networking. It's very difficult. But I found is interesting for me because my international work, collaboration, network is helped a lot to get my job within few days, and then where we are now. But still, I'm working the two university. In 2015, 16, I realized that I'm actually incomplete in my education. So believe it or not, I work with the two big universities, but also I study in Master of Business Administration, you could say MBA. You could see some different, you may ask, why is that? So this is the reason I would like to explain you. So I want to do here two things. One is I want to show young people like you the lifelong learning is important. Never give up. So there is no age limit. I can tell you one story. When I was in Japan, in Osaka University, my classmates were 54, 64. First time I was scared. I was just, wow, they are just like my uncle. And why they're here with me? Because I was 30 plus, so I was young. I was a little bit different mood, you could see. So, but I learned a lot from them, and they also learned a lot from us. It's just mutual. It's just mutual collaborative approach. That's still I practice. That's why even though I am 50 plus, I went to the school and I studied with 25, 35 plus people, and we really enjoyed. And I did my MBA. What I did there, I learned how to speak, effectively, how to market your idea, how to develop something which is huge impact, not aspect. In most of the Bangladesh situation or developing situation, people looking for their title, position, power. They don't really think about aspect or their contribution or the impact. That is the problem in the system. So system will never change automatically. You need to do something to improve the system. That is why I did my MBA. So you can see the MBA is relevant to my health system. And you could see not only Bangladesh, not only Japan, not only Toronto, everywhere in the world, health system is now nakedly open, that is disrupted or now broken. So now all the politicians, ministers, educationists, all the bureaucrats, they are talking about the health. You could see health is a multidisciplinary approach. It needs business attention. It needs the management attention, which is never taught in the medical school. So that's why our health system failed. So our system failed not for the doctors. The system fails due to our knowledge gap. So that's young generation. I'm so thrilled they're coming forward to study MPH, MBA, so many things. So remember, education is the solution. Without any thinking, we should go to MBA. And imagine after the MBA, I start working for what you call uh, CCGHR as a board chair to train advocate the global partners, not only Canada, around the world, like you, people to capacity building. So I want to advocate of capacity building in the area of global health. So because my attention is social and health well-being of the people and development of the community, society, change people's thinking process. Change is happening, but very slow. But we need to educate ourselves, and that's why we build the platform. I don't know you know or not. Canadian Coalition for Global Health is the body. We have a 500 plus member, 29 plus organizational affiliation. We advocate many concurrent health issue in the world. Like example, recently, vaccine is the number one discussion. So we discuss with the different elites or G8 countries or other government to advocate. So vaccine is the right. Vaccine need to deliver all over the world. There is no business is accepted. We need to make it global goods. But we are the one who convinced the government of Canada to donate their left out vaccine because we have a 414 million doses we secured from seven companies. So we are the one advocate globally to convince the government after left out should be donated to the world, like Bangladesh, Kenya, Africa, whatever country they need. So think about service to others. So that's community service. So I work not only in academia, I also work in the local community where they improve the people's lifestyle. So aging population or disability child or mothers, they have nowhere to go in capitalist countries. Sometimes we need to pay attention, some minor thing, but it's a huge impact of quality of life. So millions of dollars we invest to support to the community in the neighborhood we call Bluff community and also nearby. So we are running the program. So imagine being a physician is not be possible to do that. So I study in public health. I study in PhD in global health, international health, and international cooperation. I studied in business and MBA. So all makes you in a position to work in the university like Ryerson and EFT. And if you see my EFT, I work to train people to talk about global health, to inspire young generation to learn about the health development in G8 countries or OECD countries or developing countries, how health system work and how we can improve the system, how we collaborate, how we evaluate things, how you are doing, and the young people are inspired and doing things very well. So, and another thing important I'm proud of, as you know, many of you know, the Canada is a immigrant country. So health system, education system is very well structured, but it doesn't mean there is no room to improvement. There is a huge room, even Canada, we need to improve. And when I came to Canada as an immigrant, I also found many physicians, many health professionals is jobless. They have no job. They were medical doctor, PhD, professor, director back home, but they have nothing to do. So that's attract me to develop an ITMD postgraduate bridge training program. And you know that this is the program and the people like you who are the medical doctor came to Canada with a huge hope and aspiration, but after the land, there is nothing you can do because system is so structured, you cannot laterally enter the system. So if you are international student, they may have some opportunity to apply for other avenue, but not guaranteed that you will get job. But that's why we need some program those who trained internationally, but they can brush up their knowledge and they can know the health system or management system in this country so that they can get in the system may can develop very well because Canada is a multicultural immigrant society. So we need to improve those societal needs by providing the education. That's why the education advocate, we started this journey in collaboration with the university and the partners. As I said, all the things in this country, nothing happen alone. Everything collaboratively with the people. So we need to develop curriculum. We need to find an appropriate instructor. We need to find the opportunity to start to work, research, like CRIDA is developing opportunity for you. So I'm very happy to mentor some of you in future. Actually, every day I got a lot of email from Bangladesh or other parts. But when CRIDA asked me to do that, I think this is a good way I can meet many of you in one shot. That I can save time and you can also learn many things. So actually, education is a mission. Is once you decide, never give up. So that is my, you can see, nobody mentored me. Nobody helped me to go there. I just try to explore. Now you have a CRIDA. Now we are here to help you. So you have nothing to lose. You have a lot of hope and opportunity, I think. And I thank CRIDA again, especially Tahmid and Rosal, your team. So you are doing phenomenal job to engage our young generation from Bangladesh and other parts of the world to learn before came to Canada so that they will not be jobless. Education is the powerful tool to achieve. Education is the key to open your life, and education is the foundation of development. Anything, so you can change. Any questions?
So yeah, so we have got a question from Dr. Shariful Islam Khan. So if you can unmute and ask your question.
Go ahead.
Assalamu alaikum.
Go ahead.
Yeah, I'm Dr. Shariful Islam Khan. I've completed my MBBS back in 2003, 20 years back, and I completed my master's in urology and currently working as consultant of urology in National Institute of Kidney Diseases and Urology. However, I actually, for a personal reason, I want to move to Canada, and that's why I'm thinking to pursue an MPH from a Canadian university. But I have a huge gap in my, though I was in work, I have been working in the government job for last 12 years. So how can I proceed to pursue an MPH from a Canadian university? What is the most rational thing to pursue that, and what would be the real scenario in my SOP?
Okay, good question. Sorry for that. Your question is so important to me. So many people personally, when they link with me by LinkedIn or Facebook or email, they ask the same question. So those who ask the same question, my answer to you first, imagine the public health is a huge, master of public is a big thing. So now you need to narrow down your scope, that what actually your mission goal. So only coming to Canada, only have another title for MPH, that's what you want, then I have nothing to say. But you need to design your career path. So I am very much aware that kidney disease is a problem in the back home, and I would like to do more research about this, why is happening, and how we can prevent or how we can make a better quality service. Design your idea this way. I would like to know more about this. Then, even though it's true or false, this should be your very much good point to start with. Then you need to think about epidemiology. You need to think about health promotion. You need to think about behavior, social sciences. You need to think about biostat, how to analyze the data to understand these things. Or you can go for thinking about the policy decision, or that means it's promotional aspect and the and the capacity building is a system aspect. There's two things. And this is the two things you need to think. And then accordingly, University of Toronto is not should be your number one choice. You should go every university by Google search which university, which is very much close to your heart you want to study. Then from your heart, you can write a very good letter of intent and to apply for this. Before that, further one step back, all of you need to prepare yourself IELTS test, which is mandatory. So don't make any excuse with yourself or other. So I study in English, I did this and this. No. If you really want to proceed faster, make your positive impact result for admission first and foremost. When you decide you want to go abroad, do your academic IELTS. I did it when I was in Bangladesh in 1990.
I have already appeared.
Excellent. So, and then at least you secure 7 in all brand, then any university will accept you and you can do it. If I can do it without any help, 1996, now you have a lot of people connected with you with experience, you can do it very easy. Believe me, many people coming from Middle East with devastated environment, they also do the IELTS and they got 7.58. I don't know how they do it, but I can see it's possible to do it. So number one is English. Second is prepare your letter of intent. So in the letter of intent, you need to express very briefly who you are and why you want to study about this MPH, this program, and how you want to apply this knowledge you learn from the university. That makes you more stronger appeal. Canadian university professors, they love narratives. You need to tell a story, 2 pages. So who you are, why you want to study this, after study this, how you want to apply this knowledge, and you are excited to study and learn with the team, with the professors. That will give you much more confidence and understanding so that you can help in the community or the hospital or the system, whatever. So that is a global village, anywhere you can serve, where you reside, it doesn't matter. Okay. And number 3 is you need to have a very good communication skill with the professor who can write about your leadership, your communication, your initiative, your ethics, your teamwork, your respect to the other people, and working with the group, this kind of thing. All sorts of things people know about you, and they have a valid email address, and you should select them. That's the 4 things. Equally important, not only your education, not only your application, not only your letter of intent, also reference. All 4 things you need to be ready, then you go. And if you need any assistance, of course, CRIDA will suggest you, and I'm also happy here to help you. You get this point, Shariful?
Yeah, thank you. Thank you very much.
Okay, so at this point, we'll go into the second question that is from Muhammad Ahmed. And I would like to explain what is your name, explain briefly your current status, educational background, and ask the question very briefly. Thank you.
Go ahead.
Muhammad Ahmed, are you there? I think you are on mute.
Yes, sir.
Mohammed, go ahead with your question.
Sir, my question was pretty much similar to the one just asked you. I enrolled myself at the University of Regina, hoping to develop my educational, expertise so that I can implement the education and the experience in my home country. In fact, I've been working with the root level people and being a chairman of a foundation. Actually, I formed it myself, and I've been waiting to go there to achieve the degree. Actually, a few weeks ago, I asked a question to Dr. Shadia Rosenberg that is there any age limit for the people to get a government job in Canada? That was a simple question from my side.
Yeah, start with your last question, that any age for government job. I don't know. Canadian never think about too much about government job. Just for information. So any job is good job. So I don't know what do you mean by government job. That is in health sector we have a Canadian PHAC, Canadian Public Health Canada, Ontario Public Health, Toronto Public Health, Alberta Health. So we have a all province and territory. We have a health department. So we have a huge setup. So and nobody can tell you where you can go. You are the one who will be the searching these tips when you graduated from the system. Is that doesn't mean that you go for medical school, you doctor, your PhD, MBA, you will get automatic job. No, it depends on your skill and competency. So every government organization is hiring, but not always. But sometimes they're looking for. But you can't wait for only government job. There is so many avenue here you can explore if you want to stay and work in Canada. Is sky is your limit. Don't limit yourself in the government by the name of government. So I know you have a we not only you we have a preoccupied mind working in Bangladesh in the government system. Once I start job will never go. We just no need to do anything, even no problem. If we do some politics, we can keep our job. Not like that. So forget about government, government, government. Government is one force, but we as a whole, a society is a big force. So to get out from the box and think about the box, not inside the box. So government job is government job. So maybe you don't like it. Maybe you like other places because government job is not your lifetime only one thing. You think should be much bigger. Remember when you went to the medical school, in the interview, you said, I want to help people, right? If I not mistake, everyone said, I want to help people. So it doesn't mean you have to go to government to help people. Privately, organizationally, you can do if you want. So, and if you want to government, you just go to the government website. It's very transparent, and every province and territory, they have a website, and you look at it, what kind of capacity you can get in, and what kind of knowledge and skill you need to go there. It doesn't mean that you have a degree, you can get it. No, it's impossible, I could say. But if you have a skill, even though you don't have enough degree, you can make it. So that is important to think. Okay, Mohammed? And if you want to Saskatchewan, I think for many of you, Alberta, Saskatchewan, Manitoba, wherever, Canada is Canada. Don't think when you're outside Bangladesh, every city is the same. Develop is everywhere. Don't think too much. Why Alberta? Why not UFT? So don't think this way. Don't limit your fortune. Just open the opportunity. Keep your eyes open. Be flexible and change your plan. A plan you make A, B, C. If plan A is not work, then go for plan B. If B not work, go plan C. It will work. Don't just depressed or demoralized of anything. Though I don't have government job, I don't have PhD, I don't have this money, I don't have scholarship. Don't make this kind of excuse, please. So nothing will help you. Just I have to make it. And if Dr. Shafi can make without anybody's help by himself, now I have a CRIDA family. So why I cannot make it? It's impossible to think it for me. You will make it. And I'm proud to see the brilliant people in Bangladesh, they want to grow themselves. I never found this 20 years ago. I never found this 15 years ago. So the doctors and high educated people come together and listen with something I never saw. This is my historical day. I travel many parts of the country in the world, but I saw many people interested to talk, but I never saw Bangladesh people like this. So it's huge to me. I think I'm learning from you, and we are a lifelong learner. We should not stop. Today's discussion is the new beginning of your life. Just I can tell you, today in January 10 is a very memorable, significant day of my life. To learn from the young people from Bangladesh, they want to grow, and it will give me the more energy how to think about you to help more. And same thing for you, you should be proud that you are a very good platform now. They will help you. There is no interest is here. Our interest is your success. You succeed, we all succeed. Okay?
Thank you, sir. Thank you very much.
Okay, go ahead. Next.
Thank you, sir.
Please speak out, because this is important to ask question. And any question is important question. Don't keep inside yourself. Then you will die with this pain. You explore ideas. Then I will tell you, there's nothing wrong with that. Okay? It's not, don't think like our medical school. If we ask question, teacher will make you fail. Okay, you talk too much. Forget about that culture. Go ahead.
Thank you, sir. Thank you very much for a brief discussion about the admission. Sir, with a prospective student, must know the specs before admission. Sir, we want to know about the career opportunities in Canada after graduation. What are the career opportunities after completing MPH, MSc and PhD in public health? Please elaborate. Sir.
Yeah. So very important. So why we go to university? To educate ourselves. Why we educate ourselves? To work. Why we work? To make money. Why we make money? To pay tax. Why you pay tax? To improve the country. It's a very important cycle. So education is the beginning, it's a centerpiece. So once you go to a Canadian university or other G8 country university, their almost main objective to you are the main focus. Imagine no student is no university, no professor. So student is the first priority. So to build your expertise, all G8 countries, that's why they developed. That is why our curriculum is focused on skill and competency building, not to memorizing, to capacity building, so that you can find the right match somebody is looking for. So what is this? Like you want to study in health promotion, MPH, or epidemiology. So currently, dozens of jobs in public health Canada. You can see they are hiring all over the country about the epidemiologists. So all over the world, right, Tahmid? All over the province, you can see. They're sending me email. Can you recommend the students? Can you share this information? But they cannot find enough expertise people. But hundreds of people apply. Why they apply? They said, some people think like, if I apply 200, maybe I can get job. But that is not the right way. You need one job. Better prepare yourself. Go to the right program. Develop your skill, not to earn the ABCD degree. So develop something. What you learn for MPH, this is matter. If you ask me what I learned from different, I can tell you specifically. Like in master degree, MPH program, I learned what is research method and how we can do the research. In PhD program, I learned how to do action research, not only research for me, how this research can impact people's lives. And in MBA, I learned how to put all these pieces together to make economic impact. Like if I train 5 doctors spending $100,000, how these 5 doctors can contribute our society. And I said, if I spend $5,000 to train one physician in this university, this doctor or nurse or midwife will go to the job and next day they will pay $12,000 tax. That makes your economy attractive. Then university is so happy. Oh, this is very good thing, Shafi. Go ahead with the money and start program. So every degree I went, I learned something new. That's why they listen to you, because education is the power. So once you have a degree in your mind, You want to go to Saskatchewan, you want to go to Ryerson, you have to go to UFT, you have to go to Hamilton, McMaster, Western, whatever, doesn't matter. All the curriculum is sound and proven that it helps sharpen your knowledge. Then you find your sweet spot or favorite strength where you want to go. And accordingly, before you finishing your degree, you start networking, professional networking, finding the space where you want to go, make relationship with them. Remember, in this country, relationship matters. Relationship is number one, then trust, then you can go anywhere. So many PhD, so many MPH are looking job because they don't have any platform. They are so stubborn sometimes. They don't want to go anywhere. They just thought, I'm knowledgeable, I don't need to go anywhere, which is wrong. You need to collaborate. You need to learn from everyone. So when Rajan asked me to come here, I just gladly accept, because today I can learn something from you, because you are the powerful machine for my career journey. So my career journey starts with the students. I graduate, postgraduate students. I learn from them rather than I learn less from the professors. I learn from the students. That is the learning thing. So imagine one small example. We are here now, how many people? 40 people. 40 people. I strongly believe everyone, you have one excellent skill, which you have, I don't have that skill. If I know just today, I can learn 40 skill. Imagine if I know 40 skill in this world from US to Bangladesh, who can deny my job? You just tell me. If one person know 40 things, and that's why I said this day today is the remarkable day in my life. I don't know about you, but I can learn 40 people's mindset, 40 people's thinking process, how they think. So I can design my program. I can help people like according to how they want, not that how I want. So it doesn't matter how I want. So I like something different. Maybe you like something different. So I need to adopt and adjust and develop. That's why when you are in the program, you need to start networking, start thinking which is your strong interest, and go for that. And you will be successful. You need only one job. Don't think too much. So I apply 10, nobody reply, nobody will reply until you made the criteria. There is no politics here that you are not Awami League, you are not BNP, you are not Jamaat. Everything is perfectly depend on your skill and competency. No politics in the education. So you need to be very strong mindset. I'm working this, and from this, I would like to study about this, and I need to learn about this. This capacity and awareness will help me to get my next dream job. That is, and never think one job is the last job. Maybe that is the beginning of your new chapter. So Canadian or other developed country, they never think, so this is my only job and last. No, every job you learn many different things, and then you are more powerful, and then your knowledge and capacity you can translate to other area in future jobs. So but start today thinking about study and thinking about relationship building, thinking about the professional networking, which is very important. And I think in this case, CRIDA is taking incredible role to support you. I just thrilled to how Roselle and Tamit organized this for you. So yeah, we should give them heartiest thanks to help support the young people voluntarily. So it is not their job. They just want to contribute to the society. That's the way when people stay abroad, they have a huge intention to help support the back home people. And that's extremely commendable. Does it make sense? Supriya?
Thank you so much, sir. Yeah, so we have a question from Dr. Mohammad Jahidul Islam. So I'd like to give the floor to Dr. Mohammad Jahidul Islam to ask directly your question.
Go ahead, Jahid. Jahid, are you there?
Dr. Jahidul Islam.
Maybe lost him.
So I don't.
Maybe go to the next.
Yeah, maybe we can move to the next one. So we have the next question from Muhammad Tariq Hussain. Tariq Hassan, you can go ahead.
Thank you, sir. This is Tarek, and I am studying Masters of Public Health at University Eastern Finland. So I want to pursue my PhD, especially focusing on University of Toronto. So most probably, I just want to know how to get the funding opportunities, because funding is the biggest question for the PhD programs.
Yes, very good question, Tahmid. Those who are in PhD, I just would like to start from my journey, because it's better to give you evidence. So when I went to study PhD, I have no funding. I was also scared, exactly like you. What's going on in your mind? I know. I can read your mind.
Yes.
But I never give up. I work more vigorously. You can see in my back, the Prime Minister of Bangladesh, Prime Minister of Japan. So that changed my life to PhD very easy way. So then after successful project, 18 months only 18 months, I dedicate my time to develop the build hospital. You can see Ajimpur Maternity Hospital. So to negotiate, I have the special capacity to make people yes, and to motivate the administrator to do some good thing. And I was successful. At the time, Japanese ambassador and the Japanese JICA, they impressed about the work, the level of work I did without any corruption. You know, now is the problem number one in Bangladesh. So, and how I deal with this, with the politician, with the bureaucrats, without any office, without any portfolio, but as a person, I did this with my group, with my team, who support me a lot. And I got a scholarship, imagine, unbelievable scholarship, because in developed country, the PhD program, you can go with your own money. There's hundreds of $1,000s you need to invest, which is not feasible, which is not possible. Even developed country, they never do. So one thing I want to assure you, the UFT or other university, once you get accepted, you have a tons of opportunity to apply for the access to the fund. And it is not a big deal that you should stop yourself and secure your funding first. No, you need to focus your admission first. And even I am telling you now, many universities even don't need supervisor. You need to make your huge impact on your application again, so that you are scholar, you are impressive, you are very good potential, then supervisor will come forward to accept you. But now you need to qualify your CPA, your letter of intent, your references, your proposal, 2 pages letter of intent we call. If you convince people, that is the trick point here. You research about the Dalla School of Public Health or other university faculty you want to apply, look at the profile of the faculties, what kind of research they are doing. You need to focus on that agenda, then easily university professor will attract it to accept you. So that is important. So I don't think any of you, those who joined today, you have a less potential to go to any program, but think about first your application stronger application. Don't think about the scholarship at this point. First thing first, your starting point is secure admission. University will be crazy to help you to secure your funding if you're a scholar. We are looking for extraordinary talent people like you. So I don't think any student has any difficulty once they got the admission offer in the EFT as a PhD program. I'm so happy. Last 5 years, our PhD student from Bangladesh is increasing. So we have now several PhD students working in different departments at EFT Lana. So I am so thrilled. Even many people knows many faculty nowadays. Previously, we have no idea. So that's the way you connect with the people and find out your strengthening point of research. Then ask me questions by email, shafi.bhuiyan@utoronto.ca or dr.shafi.phd@gmail.com, or contact Shahriar. He will connect with me. You got the point, Mohammed?
Yeah, yes, sir. Thank you, sir.
So from today, don't think about the money first. So money is a byproduct always. I tell you one story. When I go for Master of Public Health, many of my friends said, you are going to choose the poor pathway. You will be poor guy. So you are not practicing medicine. You cannot make money, blah, blah, blah. I said, yeah, I want to be poor, but not mentally. I want to work with the people because I'm a people's person. Money cannot keep me inside the room and pressure the blood pressure, check the blood pressure and get money. I'm not that person. I am the public person. I'm the private person, whatever you said. I want to go to the community. And then community will teach me. And that's why I'm here today. And I have no problem, inshallah, with the money. I'm surviving. And my daughter in the medical school going to finish as MD. My son is going to have a business professional. My wife is working in the ministry. So I'm good. So public health never make you down if you really own it. So is a bad idea to stop your potential by labeling you. You're a clinician, you're a public health. No, it's up to you which way you want to go, and never compare apple and orange together. So if somebody want to do something practice, it's okay, fine, but it's not fine for me. Even though I'm a doctor, he also doctor, she also doctor, but I have a different mindset. Everybody is different. Everybody learning technique is different, right? You agree?
Yes,
Somebody
sir.
can study with music, somebody cannot study with music. Somebody with study with the data, somebody would like to the more words. But I'm a pictorial person. I like more picture. I can learn from the picture. So it's different. You have to accept those things. So nobody would like to push anybody, then they will succeed. No, it's not a good way. Good way is you follow your dream. Remember, again, I'm telling you, set your goal. If if you change your goalpost, even Maradona cannot make a goal because he's changing your goalpost. Today anesthesia, tomorrow this, tomorrow FCPS, tomorrow MD. Oh my God, what's going on? Something wrong. You're just going here and there. No, you focus. You go up to the end and make a fail. That hundreds of fail make you one success. You need one success. So that's my point. So don't be afraid of fail. I have a fail every day. When I came to Canada, my barrier of work was 5 inch. After 11 years today, so my barrier of work is Chinese wall. I fail every day, but next day I wake up again. But I don't share with the people what I fail. I know only. There's no point to tell the story, the failure. People will depressed. Why not I tell the story of success? Because success has so many father and failure has no father. No father, it's abandoned child. So think about explore your positive. Ask yourself what you are good at. Honestly speaking, if I have asked Bangladeshi physician, young physician, came to Canada immigrant, I asked, tell me your 3 strengths. They cannot answer. I'm sorry to say that. They cannot find their 3 strengths. They have a huge strength, but they cannot find it. They asked me, sir, you tell me. I said, oh my God, this is difficult. You have to tell me what is your strength. That you need to just message. A very simple message. Always be confident, believe yourself. And education will never betray with you. Your husband, your father, your brother, sister, everyone will betray with you. But education will just bring you up and up and up.
Thank you, sir. Sir, second last question, sir.
Go ahead.
Sir, I applied for the Europe, so I'm studying here. So in the Europe, what I've seen, I have to apply for the center application.
Yeah.
From the center application, I got the scholarship, everything. So I am here studying a full free scholarship program.
Yeah. Yeah.
So in Canada, what I have learned, I can apply for the center application and I have to communicate with the professor also.
Yeah.
So my question is, according to you, which I am understood that center application is also a good choice before the talking to the professor one. So shall I go for the center application first or first I communicate with the professor one?
It's again case by case. So you can start today with connection, relationship building with the professor. Then you can exchange idea. You know, professor, I'm also applying. So it would be great if you give me some tips. How can I be successful? It's also good. Nothing wrong. And Canadian professor want you to be update them very nicely and timely. No surprise, no drama. You need to be update people very nicely so that they can be your favor. So because one, they review the application, different professor, they give their input. We have a scorecard. I cannot share with you. So how we rating your application. So, and then every professor give their opinion. If professor already know you, it's a good advantage. He can pursue. So I can tell you, so we accept one PhD student from Bangladesh. You can imagine, I was also a reviewer. I also co-supervisor of that student. And the three people asked me to talk about that student. And I make a huge speech, 3 minute or 2 minute speech about that student to make it happen. Once I said it, other people say, oh, we agree with Shafi, let's go ahead. That's so simple, right? So simple. But he is now pursuing his PhD. He got a biggest prestigious award in this country. How? Because three professors, we judge his application and they discuss, and then somebody need to present him. Everything like case presentation. The way today Tamid and Najib and Supriya present me to you, right? That's the Canadian way. So nothing just here to just make a surprise, just to step-by-step process.
Thank you,
Right?
sir. Yeah, thank you, sir.
Thank you so much, sir, for your elaborate response. So I would like to request our applicants or participants to be brief about the questions, because everyone has a question and we want to give opportunity to everyone so that everyone can ask a question. So if you can limit yourself to 1 or 2 questions, and that would be great. So at this point, I would like to give floor to Mohammad Yasin Arafat. If you're here, you can just briefly ask your question. Thank you.
And thank you so much, Tahmid Bhaiya, and thank you, CRIDA, for giving me this opportunity to join in front of you and to join with Honorable Shafi Bhuiyan, sir. So, sir, I'm currently working as a research medical officer at James Buchanan School of Public Health, and I am at the same time, and I am studying Master of Public Health at Northern University. So, sir, my plan is to pursue either MPH or MSc at any University of Canada, particularly at University of Toronto. And sir, I have searched and I have found so many things regarding the requirements and the other things at University of Toronto. However, sir, I would like to ask 2 questions. What are the key requirements to get chance at University of Toronto? Because asked requirements don't ensure the chance always, as you know, sir. So, sir, what are the key points, sir?
Yeah, so Yasin, this is also very important question. So the requirements is the minimum requirements. All applicants, they fulfill the requirements. So if I just give you the number sense, if any program want to take 60 students, they have a maybe 300 or 500 applicants. So you could imagine it depends on the application pool year by year. So it's not that this year it works, next year will work. No. So that is 1:8, 1:5, 1:7 applicant is waiting for you. Very important question you made, that what makes you more suitable or impressive. Number one, you have to have a very impressive letter of intent, which will show your passion, motivation, and your knowledge and skill on the subject matter. Number two, you need to find a very good reference. Number three, you need to have very good academic success. So GPA, good GPA, which is very important, not only, but very important point. And then number four is many people in developing country or Middle East country, they are unaware of their resume, how to write their resume. They wrote 5-page, 10-page. Even some people have a confusion, what is resume, what is CV. Please study about this. Canadian University want you 2-page resume, and 2-page resume, it will show what you have said in your letter of intent or other places your strength, your capacity to pursue the program. Nobody wants you to fail in the program. Is a program discredit if you cannot succeed. That's why they want to see your accomplishment. So I suggest you to learn how to write a impactful 2-page CV, not list up your degree, not list up your title positions. No, you have to think about impact of your life. So far, what you did, what you can show the world. You are accomplished person. Like if I want to talk about who talked in the first in the Shariful, that he was working 5 to 6 years or 10 years, and he need to tell about I was a medical officer or consultant in National Kidney Institute. That is not enough to me. I need to know in that position, he treat 100 patients per day, and the outcome of the patient was 100% was satisfied, and he did this. The number can show the impact of his work, and that is why the quality of services improved. Many health seeking patients came to this hospital due to his service, or hospital improved their turnout rate. This kind of thing. I don't want to listen. He was a director, he was a deputy director. It doesn't matter to us to evaluate him. I want to see his impact, not his aspect. I think I can make it clear, all of you again. This is very important for Canadian University. Not list up your degree, not only list up your, of course, degree important, otherwise you cannot come in, but not importantly, mention only degree and the position title. You have to make 1, 2, 3, 4 bullet points so that you can show your impact when you are occupying that position. That will make you more strongest impressive, because Canadian, the universities or recruiter, they spend 30 seconds of time, 30 seconds, believe me, only 30 seconds to show your resume is impressive or not. If not, just go to the next, then go next. But if you have a very good impressive at the first half of the page, then they will look at it. Then they will read your letter of intent. Then they will look at your application. Then they will make a decision to call you or to invite you. That's the system, how it works. One simple thing, stimulate them to go to the next thing, stimulate to the next thing, stimulate to the next. It's a chain reaction. It's just not that you gave a huge application, everybody will see everything at once. No, you have to make a case. You have to make an impression. Like a first sight love, when you see somebody, you think, I like her, I like him, I like this style. Right away, immediately you have to make this decision. So same thing in Canadian things in recruiter, they want to see your resume or your cover letter is impressive. Then they go for the next. Otherwise, no matter what, it will not work out.
Thank you so much, sir. So if it is okay with you, then I would like to ask another question, sir.
Very quickly. I want to answer everyone's question. Sorry.
Okay, sir, I will be very brief. So, sir, there is a requirement regarding MPH at University of Toronto, that is, I have to have a biostat degree prior to the admission. So, sir, how to fill up the required biostat course? Because, sir, as you know, sir, I have asked this question to many persons, and many people have many minds. So, sir, as I'm studying MPH at North South University, so, sir,
I think that this is also one of the limitations, not only for you, many countries, many developing countries, again, many other parts of the world, their curriculum is not strong enough. In Canada, we undergraduate program, they have all the research and research method program is embedded, so that they're easy to go for this. That's why there's no problem. So for the Bangladeshi or Southeast Asian people, those who are doctor or health professional, I know for sure they have no statistics background, no research background. So my suggestion is that don't stop yourself. Now is the corona world, post-corona world is very good. You have so many online university, so many online courses offered, and you just take one, and then it will is help you, at least none. So you can write in the in your letter of intent. So I did this course, and like example, Abacus University or Coursera and something, I don't know. I don't want to mention any university. I'm not doing university promotion today. So any university, you see there is a fundamentals of research method or biostat course, you can take it. They accept it. This online course is halal. Now, believe me, don't think online course is not halal. It's halal everywhere now. So everything is good. So don't think too much, at least. And if you want to go to MPH in social science, you need to have some social studies subject, liberal art. That is another discussion point. I can talk other day. In Bangladesh medical curriculum, there is no communication, no art, nothing there. So we are just a doctor. We just treat the disease, not the patient. That's the problem you have to understand. We're just very good at treat the disease. We're not good at to treat people. No, that's the lacking of our system. So our curriculum is backdated. We need to improve it. But who to complain? There is no time to complain, and no way to complain. That is not my point. Point is, don't wait. Just start by your own, because there are so many universities, so many online is there. You can take these courses, and then you can fulfill the criteria if really want it. But so many universities, you don't need that. Go for other universities. Those who don't need, if you want to really move now. So if you want to wait, you have to go through this process. Do you understand, Yasin?
Absolutely, sir. Thank you so much, sir.
Thank you so much, sir. So I would like to request our participants now, because we have completed like different questions. So maybe some of the questions have already been answered. So I don't want to go into or delve into like too many questions at this point. So I would like to request our participants to limit you one question, and if you have two questions, incorporate into one, or what is the most priority, like what is the pressing one, ask that question. So next we going forward to Faria Bushra. Please ask your question.
Thank you so much, sir, for this insightful and motivational session. I'm Faria Bushra. I have recently completed my Bachelor of Pharmacy from Brack University. Well, my question is, in many Canadian universities, GRE is not listed as one of the prerequisites for admission. So in that case, the candidates who appeared for GRE, are they more likely to secure a fund in PhD programs or?
Yeah, sorry, freeze. Can you hear me, Tommy?
Yes, sir, we can hear you. Yes.
Okay, so I think Bushra is freezed.
Would you please?
Anyway, Bushra, can you hear me? Faria Bushra?
Yes, sir, sure.
Okay,
yes,
so
sir.
Your question is twofold. I would like to go, first one is GRE is some universities mandatory, some not. Yeah, you rightly mentioned that. But if you want to go to PhD with the pharmacy degree, I'm not sure people will accept your master degree from Bangladesh for PhD. You have to check it. The second is, I recommend if you do master degree, try for the master degree again in Canadian, because the reason I am telling you, because in Canada, hundreds of people in the undergrad degree program, like if you see pharmacy in the class, maybe
Yes.
200, 300 people, and out of 300 people, only 10 or 20 people, 20 people or 30 people, or at least 50 people go for master degree. It means another 300 people go for job, and then 50 people go for master degree. Out of 50 people, they engage with the professor, they learn research, they work together as a graduate team, and then only out of 30 or 50 people, 2 or 3 people go for PhD. It means a PhD is narrow it down your opportunity, and the professor already know them. That's why they're taking their own students. So that's why when you apply from outside, no matter what, your chance is negligible. But it's not impossible, because I don't believe impossible, because impossible itself says I am possible, right? Impossible said I am possible. But you have to be that extraordinary star, then you can get in. That's why I think we need to revisit our plan once we have this undergrad or master degree, go to PhD. Not all of you, some of you may need to revisit the reason I said I think it will make sense to you, because I don't want you to be frustrated. You apply and you'll be denied. You apply, you'll be denied. is not a good thing. You need to know first before you apply,
Yes.
and then it will be better. And GRE is not important in many universities now. Due to COVID, also more importantly, I can see is you can easily web, but make sure each university website what is their decision. Every university their own decision, okay? But don't limit yourself only one options. Open plan A, plan B, plan C, and that's my point. You get your point?
Yes, sir. Thank you so much, sir, for your answer.
Yep.
Thank you so much, Freya. Now I want to give floor to Sherin Hussain to ask your question.
Thank you, Tahmid. At first, I'd like to thank you, sir, for giving your time to us. My name is Shahrin. I have completed MBBS from Sir Solimullah Medical College in 2012, and then I completed Master of Public Health in Epidemiology from Bangladesh. I worked at ICTDRB for a while, and then I came to Canada and I completed Master of Public Health degree in Epidemiology from University of Alberta in 2019. And currently I'm working as a health data analyst at the Alberta Bone and Joint Health Institute. So I have two questions. My first question is, what are the major changes that are coming in the field of public health research in Canada in the post-COVID period? And what are the skills, for example, like soft or hard or technical skills that we need to develop to prepare ourselves for the future job market in Canada? Thank you.
Excellent. I think, Shireen, congratulations. So you did so many accomplishments, and many people may don't know. I'm so proud for Shireen because I also came from South Solimullah Medical College in many years ago. So it's always happy to see the people coming from the same school. It's a huge heart there. So SMC is our very good place. And then the Shariful, Dr. Lilin now is the principal. He also was director of your kidney disease. So we have a very good fun time in the medical school. So anyway, thank you.
If you don't mind me asking, which batch you were from?
SS14.
Oh, I'm 34.
Yeah, so many years ago. We went to the medical school in 1986. Maybe many of you were never born at that time. So yeah, so anyway, thank you. Yeah, you did an extraordinary accomplishment. And I think in Canada, you noticed that skill-based, competency-based public health we are looking for. Solve the problem, solution-based, not creating a problem. We are looking for who can solve the problem. So your analytic skill is #1 priority, and you open to other idea, also another added value. So if you have another analytic skill, what does it mean? You have to have a sound research skill. You have to have very good research writing skill, not only scientific writing, we call it KT, knowledge translation, how other people would know what you did. If you talk about the anatomy or biochemistry language, people will not understand, right, Shireen? So you have to talk about general language, then people will understand you. So in other words, you have to be a very good communicator. You have to be a super communicator. You have to be analytic, and you have to be visionary. People hire in this country the junior staff or mid-level staff who can give their bosses the big new idea so that they can work on this idea and they can innovate, because this is the country of innovation. And innovation is the highway, it's endless. Anything we can innovate together. So that is three main focus. And most added thing is you have to have a very good leadership skill, and you have to have a very ethical leadership skill. So you have to be very frank and fair and honest with your profession. That makes you more easier where to go. And in overall, all the pieces, if you connect together, you need a mentor. You need a network mentor, professional mentor, who will help you. Like you go up and they will hold you, not pull you. They can push you. It's not all about you. It's a team effort. So it's not about me. It's about all my team. That is how it works in Canada. I think Shirin, you already noticed that. So your next level journey will help you. The more your professional connections, the better your prospect will be. So don't be afraid of reach out to any profession So you want to go there and involve with the professional organizations, take the membership and join their discussion, seminar, workshop, present your idea and speak up.
Sounds good. Thank you so much. It was really helpful. Thank you.
Yes, just only, there is no magic pill in this country for immigrant like us, you and me, Shireen. We have a two poison pill. They're killing us. One is the Canadian education, one is the Canadian experience. So we are lucky that you study in Alberta or Calgary, and I also study in business. So we kill that business poison pill. And you have the experience now in Alberta, and I have the experience in EFT and Ryerson. So we dismantle these things. So it cannot any factor for us. So our factor is different now. You have to expand your horizon, expand your network, and show who you are and how far you can go is up to you. Sky's your limit. Good luck, Shireen.
Thank you so much.
Thank you so much, Shireen. Now I'd like I'd like to give floor to Mohammad Mahfuzul Haq Haidari. You can go ahead.
Are you there, Mahfuz?
Mahfuz, you are on mute. So if you can, yeah.
Hello.
So
Good morning, everyone. I'd like to thank our honorable professor.
I don't know, one thing, Tamit, all male people is so shy, they are not showing their face. What happened? In the Bangladesh people getting opposite? So I want to see who are talking.
Okay, so, yeah.
Yes.
Yeah, the thing is that I am a graduate pharmacist, and after that, I joined in two global pharmaceutical companies in my country, and I worked in the manufacturing side in Sanofi, Bangladesh, and after that, the Sun Pharmaceutical. And luckily, 3 years ago, I got the Chinese government scholarship from our Minister of Education to pursue my further postgraduate degree in China. And I completed my Master of Medicine in Public Health and Preventive Medicine. But the thing is that because of my previous experiences in the pharmaceutical, I did my research on biomedical based on the cardiovascular protection under the supervision of a Chinese professor. But the thing is that as a public health pharmacist, now I want to pursue my further PhD program in Canada, but I am a little bit confused about my further career perspective in which field I will select, because now I have so many experiences in different sectors and I gather so many skills. So based on that, which position, which will be secure my position in further career in Canada or even in Bangladesh? So that is my question. Which PhD option will be suitable for me?
Yeah, this is very hard to tell one answer, but I can give you some context to understand your decision, because you have to make your own decision. So I don't know your whole scenario, so that I can give you just prescription. This is the no. Just what I can hear you. Many of our Bangladeshi talent people here, everybody has the huge potential, multiple strength. I know for sure. Otherwise, you should not stay in the midnight to talk to me and join me, is for sure. So I have no doubt. But you need to prioritize your needs. So which would go to the priority? You know, the best leader always have the same time like you and me. So 24 hours for everyone. But you see, our prime minister doing whole down the clock. They are busy than us, but they're managing because they prioritize which is the important, and they delegate some power to other people to do that. So all priority delegation makes our team effective. Same thing when you own individual so many pieces, your accomplishment. I'm so happy to know that. But now you need to focus on PhD, right? Now you need to solidify your idea. What kind of thing you want to do in PhD, and why? You want to go to the teaching, or you want to be a scholar or scientist, or you want to do the government job for promotion? It's different scenario in different aspect. So you need to ask yourself first. And then if you want to go to EFT, you will see top of my mind, I can tell Professor Jobin Astin, go and see him. He is a pharmacist and the dean of the School of Pharmacy is my friend. You contact him, copy me, and let's see how we can help you. So that's
Would you
quickly I
please,
can tell you.
name his, would you please tell me his
Professor
name again?
Jobin Astin. Jobin Astin.
Jobin.
Yeah, he's a pharmacy dean of the pharmacy. Yeah. Okay. So
Okay, thank you, sir.
everything depends on you. What kind of research you want to do? You have to solidify your idea first before asking other people, what should I do? Because your situation, I don't know. I know only you have a huge credential, you study abroad, and you gather so many things. Now you need to apply. Whether you should go for PhD really, or you should go work for Bangladesh. You don't need to work for any government. You don't need PhD, but you need PhD to go for teaching, to go for scientist role. Or you want to go for other things is different thing. But the two things is in my mind. When I choose the PhD, I thought I want to be teacher because that is my strength. Now I want to manage the program. That is my strength. So I want to develop the program because I'm a builder. I'm a promoter. I want to inspire people to study more. That is my job now. So even in this age, right? So it depends on you, because I'm sorry, I cannot give you a very specific what you should do, but I don't want to tell that what you should do, what you should not do. I want to give you 3 or 4 options. You decide which way you want to go. Like you are in the Tezgah, in the 7th Road junction, which way you want to go. You decide based on your interest.
Okay, thank you for your answer.
Thank you so much, sir, and thank you, Mahfuzul Haq. Now I want to give floor to Vaishnavi. If you're there, you can ask your question briefly. Thank you.
How are you, sir? It was great talking to you. And my question is, sir, I'm basically from India. I have done my BDS and then I've pursued my MPH in epidemiology and biostatistics. And then I have gone for an MBA in hospital management. And then I moved to Canada. And now I want to do my PhD. But I have also applied for MSc epidemiology programs as a safe side, because I want to start my education. So my question is, I have tried contacting potential supervisors, but I was not successful in attaining them. So I want to know, like, what do the supervisors expect and where am I lagging? Is it like my education is entirely from India? Will that be a disadvantage to me?
Okay, thank you, Vaishnavi. Yeah, we have a similarity. We are Canadian immigrant, and
Yes,
we have an MBA. We are health professional. So all 3 things we are same. So that I can easily feel your issue. So first of all, do you know most epidemiology successful important in this country from India? Who is this?
I think it's one of my professors, Dr. Rajan Patil. He is right now the epidemiologist consultant for the COVID for the South Asian countries.
Oh no, I'm talking about the Prabhat Jha. I'm talking about the Madhu Pai. Those who are the
Yes, sir.
biggest epidemiologists, they are from India.
Yes, sir. Yeah.
And so, have you ever reached out to them?
No, sir. I'm sorry, I
So
haven't.
they are from India, and they are mentoring hundreds of young professionals like you. In return to your question, so you're writing people, you are not successful. It means that you have to acknowledge first there is a communication problem. Your communication was not sufficient to draw their attention. It means that what they want to listen, you are not telling them that story. You are telling your story, which they are not interested. You understand my point? You have to do puja, what puja I want. Then I will come to you to listen. So same ideology, you have to use it. So you have to go to the epidemiologist who is doing what, and you have to tell that story, that their language. That way, language means in not Hindi or Urdu, in English, but a narrative way. You know, I am a dentist and graduated for public health and passionate about the business model in the epidemiology or this kind of thing. I would love to meet you and guide your expertise so that future I can be part of your team. And then I can, here is my brief citation about me, who I am. Here is my resume for your kind attention. It would be great if you ask your team or your assistant to give me a 15 minutes or 30 minutes time to explore my opportunity and how can I help your team. Then they will listen to you. If you said, I am from India, I am MPH, I have a BDS, I have a PhD, I want to you under supervision, and thank you very much. So it's not work.
Yes, I
So
get your point.
you have to relate the story with me or other professor, how I listen. You are the driving force of listening or not listening, right?
Yes, yes, that's true.
Don't blame other people. Learn a lesson from your writing. So I wrote 20 times and nothing worked. There's something wrong with my writing. Go
Yes,
for to improve it.
I did talk to a lot of people and correct the way I emailed, I corrected my resume, I did do a lot of things. But although I get a response, it's mostly like, I don't think your research interest aligns with our research interest.
Exactly.
So yeah, better luck with pursuing someone else. So that is how I get the responses.
You don't know how much I love the BDS people in my program. Every time I'm a personal story. So 2-3 BDS from India, they study and they got a good job. One of the BDS, she was working in the airport, a non-professional job. I bring her in my program, I teach her. Now she's a scientist in St. Michael Hospital.
Wow.
Yeah, can you
that's great, sir.
BDS like you? So
Okay.
depends on how you connect with the people. Public health about connecting the dot. So,
yes, sir.
And my job is matchmaking. I connect people with the people, and once they're in the program. So you should be, by now, you should be know my ITMD program. So it's
Yes,
very
sir. I do know it.
well familiar with the Indian people. So, and all people are successful. So there is no reason to believe you cannot succeed. You just change your strategy, communication style, you will be successful.
Okay, sir. So one more question I have. So it is about the career opportunity. So when I see for job postings, it's mostly like MPH or MSc. There are not many people who hire PhDs. So like, is it advisable to go for a PhD? Because I know that I love research and I want to pursue research. That is one of the main reasons why I deviated from a clinical practice. I had a very successful clinical practice running in India, but I shut down my clinic and then went and pursued my MPH just for the sake of research. So how is it, sir? I just want to know, just an enlightenment.
Again, very tough question whether I should stop your excitement not to do PhD or to do PhD. My job is to inspire people to do more. Because I'm a PhD, I always infected people to do PhD, of course. I immigrated to Canada from Japan. I inspire my Japanese alumni to come here. They came here. I stay in Thailand. My colleagues, they come here. All I do, I show the evidence. So in other words, I lead with evidence. So I cannot tell you should not go for PhD. I will be happy if you go PhD, but there is a but. What is the but? You have to go through slowly but surely.
Yeah.
So a PhD is a huge commitment in Canada, 5 to 7 years. And you have to understand 5 to 7 years, again, you have to be jobless.
Yes.
You have to think yourself. So that is very stressful because PhD will come with diabetes, hypertension, insomnia, divorce, frustration, mental health, 7 cousin they have. Okay?
Yes, sir.
So you have to prepare for that, the win. Don't go for PhD and stop it. No. You think before you act. Once you act, you cannot reverse it. So that's why my recommendation for you as a new immigrant, think about to involve in the job. In PhD, not necessarily you have to jobless. Once you go and find a job to survive, and then you do the PhD part-time, then it will not hurt you. At least you have nothing to lose. You have something.
Yes,
you know,
I understand that.
at least you win. I'm working and I'm different than other. I'm not jobless and part-time. All the university professor in this country, except part-time student, 7 to 9 years, you can do PhD. So you can follow your dream, and also you need to build your career. How Canadian workplace function? Because you are new to this system. If you don't know, if you have a PhD, but then you go there, you will be frustrated.
Yes.
So better and expectation of the PhD. I missed your previous questions. PhD supervisor, even they don't know what they expect. It's not your problem. It's also our problem, because you should be the guide who would like to go, and we should just advise you whether it's work or not. Because I know I passed through this journey. I know what will happen next. That's why you need to propose, and that supervisor will guide you whether it worked well or not, whether you should change or not, whether method is okay or not. This testimony of your work, nobody will do it for you. Just remember, in this G8 country, you are the driver, the PhD supervisor is a supervisor, instructor sit beside you. You need to driving the car, and you go to the speed with your speed limit, and in the middle, PhD supervisor will say, I will drop it here. You now drive you alone. You are your own. Think this scenario. That is it. That's why you have to prepare yourself, equip yourself.
Yes, sir. Thank you. Thank you so much.
Yep.
Thank you, sir. A much great discussions and very much interesting questions from the learned peoples. Sir, now I want to ask you a question. Sir, we know that you are already involved and have outstanding accomplishments in global health research projects, especially focusing on maternal and child health. According to you, what do you think of the most significant research areas that will have immense impacts in the global health domain as well as help to secure admission and scholarship? Sir, will you describe us, please?
Yeah. So, most important, can you hear me? Okay.
Yes.
So global health is a huge. Global health is not only one word. Global health is the huge, like health system, maternal child health, HIV, now vaccine, coronavirus, is environmental health, artificial intelligence, whatever. Everything is global health. It's huge, but you need to just learn how to do the mixed method research. You need to develop your fundamental of research skill. So then it will guide you to the next step to think what kind of topic you want to start with the global health, and whether this study is concurrent, or somebody did something, or somebody missed something, or latest viewpoint, you feel something gap is there. So as a researcher, you need to find the gap, and to address the gap, you need to find a solution. To find a solution, what kind of method you can apply and you should apply, your research skill will tell you. That's unique. So I don't want to bias people only you have to do maternal child health, but maternal child health, imagine, is the central piece of the health system. If you can give one healthy mother, the healthy mother will give you a healthy baby. This healthy baby will give you a healthy nation. So that's why I choose 25 years ago to work with the maternal child health. You could imagine. And if you think about the Japanese story, 50 years ago or 100 years, 1948, so Japan was a poor country, and they get money from the World Bank, WHO, and then within 50 years, they become global G8 strong economic country. How they build it? They start thinking about the maternal child health first, and they start this maternal child handbook to promote their health system, to learn, to teach people how to care 9-month pregnancy, what to know, what to do, what not to do, so that they deliver a healthy baby. That healthy baby build is today Japan. So same thing, any country, they should focus their health system by strengthening their maternal child health. But of course, there is a politics. So public health or health is the political football, and people's health is the football. Every government from Toronto to Bangladesh, everybody said, if I got elected, I will be a champion to change the health system. But after the elected, what happened? Nothing happened. So that's the long discussion. I just want to tell the young professionals, research is number one skill you need to focus. Number two, you need to find a topic where is the gap there, so you can suggest some solution. Number three, you need to be patient, and you need to be cooperative. Nothing you can do alone. Nothing you can do alone. Alone you can do so little. Together you can do so much. You need to believe it, you need to practice it, and you need to respect other people's idea and ensure that you are in the team. Then you can be better public health professional. Then you can be inspiring agent for change. Change never happen right away. Change is a lot of steps. First, you need to do small pilot scale. Then you need to share this result with people. Then you need to build your alliance and you need to convince people and then go for the big. So that's the way public health work in the world in developed country, or it should be the way you should move forward. Okay, so that is why I think involvement in the research team is number one priority. Second is to learn how to disseminate the research by writing skill. You need to learn about systematic review, how many things happened and how we make it one or plain language summary. That will help you much more to give the Canadian universities attraction, because then they will know you are accomplished and you have publication and you are a very good communicator. Even not only your personal statement, you also research scientific writer. So that's also help you.
Thank you so much, sir. Actually, we are within our time limit. So I would like to ask you, because we have a couple of questions, and I would like
no
to ask
problem.
your
Go ahead.
permission to go forward.
Yeah, go forward. Whatever it takes. I want to make today everybody satisfied before the leave. Yeah, okay.
Thank you so much, sir. So I would like to give floor to Shushmita. You can ask your question briefly. Thank you.
Thank you. I'm sorry for the technical difficulty. I can't turn on the camera.
No problem.
I'll be very quick. Thank you for all the information you've given me. My question would be how to re-enter the public health market in Toronto or Ontario after a break of 6 years, because I have a master's in public health from States, but I've taken a break of 6 years for a personal reason. That's my question. Other question is what skills or education should be upgraded? Should I upgrade to make it easy to enter the market? And how do I develop contacts? Because most of the jobs, they need a contact. And since I've taken a long break, how do I develop my contacts? I do volunteer for 1 or 2 organizations, but that's not good enough as contacts. So that's my main question: how to re-enter the public health market after time. Thank you.
Thank you, Sushmita. You are not the first person. You are not the last person who has a break. So it's a life journey. So Canadian university professor system, they know these things. So even for women is also common. They have to have a family change or some new life or migration, so many things. So don't pay attention if you're 6-year break, it doesn't matter. As you said, you are a new immigrant and you have a degree from US. And I have several students like similar situation like you. What advice I told them, they need to go to the university again to brush up their knowledge so that they reintroduce with the system, with the mentors, with the professionals, then they can easily find the guidance and the right fit for them. This is all about the right fit, who will think that you can contribute based on your experience in US and you can translate to the Canada. So that you need to be a group of professional body you need to connect with. I think you should be focusing on that.
In the sense, what do you mean? Like a university? I need to contact
Yes, you need to go to the program.
Oh, okay, but I already have a master's, so
it doesn't matter. I told directly, it doesn't matter. You have a master's in US or Bangladesh or India, it doesn't matter. You need to brush up your knowledge in Canadian way.
So are there any certificate courses or anything that you suggest?
It's a tons of certificate courses. If you go and Google, you can find a lot of things. So yeah, you contact with Tamid or Sharia, they will guide you.
Okay.
It's a tons, not one. It's a huge opportunity for industry trained health professionals now in Canada.
Lots of great interest right now. Like what's in demand in public?
Demand is depends on your interest. Like you can go for COVID case manager. You can go for contact tracing. You can go for mental health. A lot of demand now. Unbelievable. My students are getting job every day. I just wake up in the midnight because they're sending me, text me, sir, I got a job. And not only Canada, in US and UK, NHA, I'm writing recommendation for every day now for getting job and people getting job. This morning, I got a text message from one of my Nigerian students said, sir, I'm just testing you because I cannot stop my excitement to contact the professor that I got a job. And you are the one who helped me a lot to come this journey so quickly. I said, I don't know. That's a huge opportunity now for international trained health professionals in Canada now.
Thanks a lot.
Thank you so much, Sushmita and Dr. Shafi sir. Now I would like to give floor to Mahfuza Luna. And I know from your questions, like we have already talked about the biostat course requirement. So is there any specific other question that you want to ask? You can go ahead.
Thanks for this wonderful session and thanks for giving me the opportunity. I had another questions regarding the specific any discipline of public health which has a high demand in job market in Canada after completion any post-graduation program actually. And I want to add another question which is if anyone has no publications, is there any negative impact in case of getting admission in Canadian university? Thank you.
Yeah, thank you, Mahfuza. Actually, thank you for your second question. I start with no. The no publication, no negative is not a point because nobody is expecting that is mandatory. If it is there, is ornament, is added value for you. First question is which discipline? Actually, I prefer to ask you to do some research work, give some effort, which is important. So if I tell this one is not actually appropriate, is user perspective, you need to see the world from your viewpoint, from the rooftop. That's why any discipline is good discipline. When I study urban health, is nobody even know what is it, right? Now with urban health is huge issue. 20 years ago, I studied urban health. So we also don't know. I research this, maybe urban health need these things because global is going to urbanize very quickly. So that is so difficult to give the access to the women's health in the urban area, those who are poor people, because urban area, you can see rich people only go to the clinic and hospital. Your housemate or other low income people, they cannot go to the hospital. So we need to think about them. You need to think about the environment. You think about the planetary health. So that's what we think 21 years ago. So now you see how attractive this urban health. So you need to be visionary scale. You need to envision yourself 20 years later where you want to go. So that's the public health viewpoint. So everybody is different, but you need to envision yourself. So I want to go for infectious disease expert, and I need to go to the vaccine expert. I need to go for HIV expert. I need to maternal child health expert. I want to go the policy scientist. I need to go for this and this. You decide. But no one single discipline is valid for 5 years maybe. So now you think this is very good. 10 years ago, HIV was the number one. Now HIV is normal. 5 years ago, maternal child health was there, still there. Now COVID is the most attractive research. Maybe 3 years, COVID will be behind. Something will come. So, but your expertise is your expertise. Nobody can steal. So don't think too much. Think one thing at a time. Now you think which was your interest, go for the degree and go for to apply for that knowledge. And then you will find the other way. You meet people and that people will guide you for another 5 people. That 5 people will guide you another 50 people. That's why you build your network 100 from now. And I encourage you to be a membership of any professional organization, not membership of any political party. In your resume, you should have a professional affiliation with yourself. So, and join the international seminar symposium. So to learn more about people, to learn about system. So I cannot see any much in Bangladeshi physicians or health professional, their resume reflect anything in the professional organization they affiliated, which is lacking of in my viewpoint.
Thank you, sir.
Yep.
Thank you so much. Now I'd like to give floor to Shakila Mahmuda Fatima. I know we have already talked about the funding, so if there anything specific you want to ask, you can ask now. Shakila Mahmuda Fatima, are you here? Okay, so maybe we can skip that one and go into the next one. So I'd like to give floor to Al Hussain. You can ask your question now.
Oh, thank you very much, sir. I'm sure you already covered my question answer. I'm also SMCM. I'm a PhD from Nagoya University, Japan. I'm pursuing my a fellowship program in the States right now. So,
こんばんは。おめでとうございました。
hi, arigatou gozaimasu.
Yeah.
Yeah. From my experience, I work for my country Ministry of Health, being a cadre of the country. I try to go back to my country and work for my country development. So I'm sure you have huge experience working with the country government and your novel desire to work for country improvement. So just share me your experience working in government settings in Bangladesh.
Yes. First of all, omedetou gozaimasu. So many people don't know what I'm talking about. So it's congratulations for his great degree, his Japanese style. So we use the omedetou gozaimasu, right, Hussein? And your English also super. And we have also some similarity. You also like Shireen. You came from Solimullah. So it's great to know that. I was not aware Solimullah people went for PhD and did something I never found before me. So thank you. I found today another one. Hussein, it's a pleasure meeting you. And I also work with Japanese. As you know, they changed my life. Japan, Osaka is my second home. My third home is Thailand, Bangkok. And my permanent home is now in Toronto. So I have many homes. So you can imagine after Bangladesh. So, and it's challenging to work with Bangladesh because of many reasons. Even though we born and brought up there, because when you go for degree, you are analytic, you are evidence-based. But when you go back, two things strike me. When you study abroad, people realize you are the privileged group. You took all the privilege from them, and they are jealous with you, and they will not cooperate with you. Number one attack I got, but I never give up. I also, like you, because you are a young man, I try to do and stay there, but they reject me. So purposely, I don't withdraw myself. I still wanted to serve in Bangladesh. And you can see in 1971, the Pakistan army gunshot me, and I have the blood in my land. So I don't know any of you met with anyone who was affected in 1971 war. So I have a huge emotional and family relationship with Bangladesh, but still I am away from Bangladesh. So due to reason of complexity of management, complexity of system failure. So system will never cooperate you, but you need to make system comfortable. But I salute you. You still survived. You are still working in Bangladesh, and keep doing. If you need any help, I will be happy to help you, because you are a doctor. You are from Solimullah. You are also PhD from Japan. We have so many similarities. So there is no reason to not to help you. But my understanding is system development is the challenge in Bangladesh, and system is not in your favor. System always with it against you. So you need to make it comfortable. You need to make compromise. You need to accept or reject. No need to be judgmental. Just do your best. But be careful. Don't overstress yourself, because when there is no system, sometimes risky. That's why I would draw myself from there. So imagine being a PhD scholar. They assigned me to go to village as a posting, as a punishment, because why I was in Japan for doing my PhD, because bureaucrats, they want me to go them, to give them something and request them by the politician, then they will give me the good position. I said, no, thank you so much. I have 2 offer letter in Thailand, in Japan. Brother, I go for my novel profession if you don't want to use me. So that was my journey. But you don't need to follow that. But now system has been changed 20 years later. So, but still, honestly speaking, I want to make one regret that I get out from the country and I'm staying abroad, people valuing me, and I think I did a mistake, but still 20 years later, I never feel that way. I think I did the right decision to withdraw myself with the help of bureaucrats. They don't want me, and so I just withdraw. But I really want to help my country. That's why today's meeting. So I cannot help people, but some of you can help. That is big help. If I can help you, you help other people. That is my motivation came from. But don't give up, Hussein, that this is our country. We don't need to be a judgmental, but we need to try our best. But how far you can give is up to you. But I cannot take that much, so I withdraw myself because I have a very dignified, very prestigious position in university, which I want. Then I just move. But you could imagine my heart, my family, everybody's there. But unfortunately, I cannot stay there due to system is not working that way, the way I want. But it's not possible to change overnight. But I said, you need to make a collaborative approach, make your friends, make a good relationship with the people, and try to do some small change and scale up that change if you can. That is my best advice, best suggestions. But you know better than anybody how much capacity you have to stay and to accept the rejection, bigger push, negativity. So sometimes it's difficult, right? So, but if you can do it, it's appreciable. But if you cannot, don't feel that you are failed. No, this is the lesson learned, I think. I don't think I cannot stay there is my failure. Maybe it's a lesson learned that I tried, but you cannot success 100% everything, right? Nothing under your control. So then better I move where people value me, where people utilize my talent, my time, my treasure. So if my country don't want to my time and talent and treasure, why should I bother them? That is my own feeling. You don't have to follow that. That's why I stay abroad. I want to be an advocate to build the capacity of our young people, which I could not done. You could do it because we are behind you. We are with you so that you can do it. And maybe one day we can see system change. And a lot of progress happened, but 20 years ago it was not there, right? So believe me, 20 years ago there is no computer other than the director's or minister's room. The computer should be covered by some paper, and it's just decoration of the room 20 years ago. Now you can see from the computer, from the laptop, iPad, you are talking to me in Canada. So huge progress has been made, culture has been changed, and online learning is halal. So many things is changing. So I'm not negative, I want to be positive. So that's why, Hussein, your work need to inspiration for the generation behind you so they can see, right? You think, before I came to Canada, I don't know anyone. I came to Canada and I was so fortunate that I started working in the Ministry of Health because they don't know me, but they hire me to work for the some project scientist. Then I started work with the University of Toronto, which is one of the high significant university in the world. But I came from Dhaka University. There is no place there in the world. So you could imagine if I can come here without any support of anybody. So who can stop you? Nobody. So only yourself. So your door is open. Even though you stay in Bangladesh, it doesn't matter. You are a global citizen now. And if you have a PhD, you have a MasterCard. So nobody can stop you. You are a global person. And you know, Hassan, what is MasterCard meaning? You have an American Express. You have a MasterCard in your pocket. There is no financial crisis for you. You can do everything you want. So you are the top 1% of Bangladesh citizen. Imagine 170 million people. There is not 170 doctors in Bangladesh did PhD from abroad. You should be proud that I am one of the 170 people in the country. If I do something, people will follow. That's the motivation. So I always think this way, no matter what government recognizes or not, I don't care. I think I'm the only MD, physician, PhD, MBA is the 170 million people. I can do something for my young generation to change, to motivate their style. So I feel proud when I think I'm the 170 people. Feel that way. No matter what, I'm not going for election, right? There's no matter what they think. The thing matter is what I feel. I feel good. So what they treat me, I still feel good. I salute the joint secretary, additional secretary. At least they decide they transfer me in bad places. I have to go for 3 days, and Shariful and other people are in the good. You are staying in Dhaka. After $5 million project, they give me punishment posting to go for the rural area to serve because I have a PhD. That is my fault. But I don't think that way. I think this is the opportunity they create for me. And I think our next generation need opportunity to grow. That is why we are in open to talk, not reserved of anyone. So I think, Hussein, I salute you. You did PhD, you went back to Bangladesh, and you want to do something. Think about the education, think about the research, think about the capacity building of the other people, and join your team. You can do a better job.
Thank you, sir. Thank you, sir. Highly appreciate it.
So, which field you are working?
So I basically work for the heavy metal pollution. So my research is based on the pollution issues. Yeah, I work basically on the field work based study in Bangladesh, chromium pollution, arsenic pollution, remediation, so such kind of things.
I think you have a very good opportunity. You should think about the postdoc now.
Right.
So in Japan, we have a lot of, because I am also JSPS scholar, you know that, how difficult it is.
Right.
So I got the JSPS first time as a physician to do the field research, actual research. Usually Japan is famous for lab research like you do.
True, sir.
So I'm the different person. I did first time to the actual research in the field. Yeah, my professor, you know, Professor Yasuhide Nakamura, who is the international president in Japan. Your professor may know him. He is my idol mentor to change my life. So I suggest you to go to different university in Canada. We are always hiring postdoc. Most importantly, your environmental health attract me because we have an environmental health science department in Dalla School of Public Health. You write to the James. He is the head of the department. Ask James, copy me. James, I would like to work on this, and I blah blah blah, and then let's see how he responds. There is so many opportunity in postdoc. Yeah, and if you are from Japan, they value you because they valued me. So Japanese PhD is only not valued in Bangladesh, but other part of the world is valued. I'm very honest with you. Okay.
Great to hear from you, sir. Arigatou gozaimasu.
どうもどういたしまして。私は本当に嬉しいですね。I'm so proud and I'm so happy and excited to see from my medical school and you have the Japanese degree, which I most respect. Of course, I respect all of you, but Japanese, you know, is a different feeling when you have the same language you study. How far you can speak, Hussein?
Yeah, basic Japanese I can. Yeah.
Same. Yeah, I speak Japanese very limited vocabulary, but my professor is very happy with that, so no problem. Because he's graduate from Harvard, we have no scope to learn Japanese. He says, "Kore daijoubu desu," no problem. Chotto dake. So we call just little, but it's okay. You just communicate, you know, body language sometimes. That's why I asked in the beginning, remember, I want to see all of you. So I love to see your body language. What I want to see, what your eyes are saying. I want to see what your heart is saying. Then I can tell you what you should be doing. If you just hide yourself, imagine you will hide from everywhere. You are invisible for everyone. So yeah, that's the problem in our Bangladesh. Maternal child health is invisible in the country. The doctors are invisible, their leadership, everything invisible. That's why we are in trouble, right? So all the Japanese degree changed my look to look the world differently. So immediately I can analyze, I can make my interpretation about anything. So that's never I learned in Bangladesh health system or Bangladesh. I work in the ministry. So I thank Japanese government. So they help us to lot to shape our life, and that's my duty to shape other people's life. That's why I'm here to meet you. It's not my job, it's my passion to help you. And that's I was looking for 21 years ago. I never found this. So that's you can say why you are here talking to me whole midnight. So I told Rosen, no matter what, I will talk to each and everyone. I want to make everybody satisfied. If today one person get benefit, I will be most happiest person in the world. And I'm sure not only one, 80% people will be successful very soon. You can say I'm the fortune teller, yes. The people I mentor, 86% is successful in Canada and the world. So don't get me wrong, but you have to do the job, and we are here to just guide you.
Thank you, sir. Highly appreciate, sir.
Thank you.
Thank you so much, sir. And now we want to give floor to Akash Barua, and you can ask your question very briefly.
Sir, Assalamu alaikum.
Go ahead, Akash.
I am Dr. Akash Barua. I am recently completed my graduation and working at Ganeshwar Medical College as a medical officer. I have two questions. My first question is that what are the chances of getting a chance at MPH in Canada as a fresher? And my second question is that some Canadian college have a diploma in health information management subject. What will it be like? What is the job opportunity after complete that diploma?
Yeah. So thank you. And honestly speaking, one of the staff is from Ganeshwar Medical School. So Akash, so I know Ganeshwar, your education very well. And
thank you.
Second question is, MPH program is huge, as I said before. You need to decide which university you want to go. So if you want to go to EFT, you cannot without any experience. But if you want to go, like example, Lakehead University or Saskatchewan University or some remote area university in Canada, maybe it's possible because you are international student. Every university wants to get international student, so they can make money. If you give one international student, there's 3 times higher the tuition than local students. So that's why don't limit yourself as a fresher or not fresher. Second is there is no such thing that public health is limit only one university. Different university, different focus, different focus. You have to decide which focus you have to go. You have to follow your dream. And second is the college. I don't recommend, honestly, is my personal, is not any, you have to follow that being a graduate, postgraduate from different part of the world, you should be going for college, community college. This is for grade 8, 9 level people. It's not you. So why you undermine yourself? I don't understand still. I know many people coming here as a Canadian immigrant and they go to community college and they go for OSAP, they go for money and they become $50,000, $100,000 debt and they get nothing and they come to me after 5 years, sir, I spent my time, 2-3 years. Now you guide me. I said, here we go. You already $50,000 debt. So it's no point as a physician, as a graduate, why you should be going to college? So you think up, why you think down? So I don't understand yet. I try to explore the reason. I think maybe one of the reason is people think it's easy. Remember, what is easy today, your life will be difficult tomorrow. If you hard today, your life will be easy next. So is your selection what you want to do? Pay now or pay later? In North America, very easy dialogue. So pay now or pay later. So I think you are young now, you should pay now, then pay later. Later life you can enjoy. But you imagine, last 25 years, I worked so hard. So I don't go any party for Bangladesh or picnic or with my friends, with college clubs, nothing. And I saw through Facebook, my friends, they are doing 30 years, they're enjoying one after another. Now they said, we want to go to Canada because Bangladesh, we cannot survive anymore. I said, here you go. You have to think before you conclude in this 55 plus age. So when we are 25, 35, you go all this fun thing. I never did. I study, I research, and you said, I'm a poor guy. Now you want to come here. What is the point? I don't understand. So that's the point I'm telling you. You have to decide and you have to think up, dream big. Dream big, don't the small thing, think big that I am a qualified person, I need to go to university. Many Bangladeshi scholars, young professionals, Harvard, Oxford, many universities they are studying now. You cannot believe it before. You see the Bangladeshi scholars, Shahriar, Rosen, Tahmid, they're working in the health system in Canada, policy change, decision making with the ministers. Imagine if you ask Rosen to tell his story, he went to Bangladesh, so far I know, people said you are so junior, you cannot contribute. Then he just came back to Canada and he's contributing a lot. Not only his work, also changing your life. So it's called societal need. Canadian always responds to societal need. That's why When I learned about Canada, I learned two things. One is the humanitarian, one is the snow. So that's two things always at my mind. Is too much snow and cold, and Canadian and humanitarian. You see that Taylor, what is her name? The CRP, Valerie. She is working for Bangladesh. She's Canadian. So many Canadian around the world, they're working for other people's life changing things. So being a Canadian, we are proud to help support my back home country, around the world people, especially health professional, which is the hero now to help support people. So don't limit yourself within the box. Get out the box, think big, dream big, and follow your dream. Okay, Akash?
Thank you very much, sir.
Thank you so much, Akash, for your question, and thank you so much, Shafi sir. Now we have a question from Farah Sabrina. So if you can hear me, just ask your question briefly. Thank you.
Thanks, Tahmin bhaiya. Sarah, assalamu alaikum. After hearing your journey, it's totally inspiring us. And I am a dentist from Bangladesh. I am working as a lecturer for last 4 years in a private dental college. Now I am trying to pursue my post graduation in Canada. So as a fresher, how could I do this?
Oh, thank you, Farah. So the dentist always very good at research and epidemiology. I know for historically last 20 years, my journey. And I'm not wonder that you also be successful. First thing I would like to ask all of you, not only Farah, please use your credential ready before that. So all the degree you did in Bangladesh around the world, you need to accredit it by WES or other agency that your degree is valid. So make
Sir,
this
it's
paper
ready. It's ready now.
great. So that's number one. And then you prepare your field, like a public health epidemiology you want to choose, or you want to choose other thing. So Farah, I'm sure if you apply for Lakewood University epidemiology program, they will accept you. So if you have a 7 or 6.5 IELTS, so this is the information matter. So you don't know where I know, but I ask you to go and search Canadian universities and the programs and the department. Then you will find you close to your heart, and you go from there. As I said before, how to write letter of intent, how to write resume, and this kind of thing, all the same. So first you need to start with doing the research work, which program you want to go.
Thank you, sir.
Yeah.
Thank you, sir.
And I think you listen already what I said about the
Yes,
other
yes,
requirements. So I don't want to
Yes.
repeat, but if you have any problem, contact Rosen or Tamid or contact me. So we will guide you.
Okay. Thank you, sir.
No problem.
Thank you so much, sir. So we have got a quick question from Dr. SM Rizwan Shofiullah. You can go ahead.
Assalamu alaikum. Thank you, CRIDA, for arranging this program. And thank you, sir, for giving me this opportunity. Can you hear me?
Some background noise. I don't know. Yeah, you have double instrument on. I don't know. Go ahead.
No, sir, it's from my laptop. It's
okay, laptop problem.
Noise.
Yeah.
Sorry for that problem. Yeah.
Very quickly, tell me.
Yeah, I've been following you for quite some time. My question is, I'm doing an MPH in Bangladesh, and then I would like to go to Canada for further studies, but I'm having difficulties to choose whether should I go for MPH or the MSc program, or go for PhD directly. And someone is telling me that I should go for a master's leading to PhD program. So would you please clarify the points that I should consider for my further career in Canada? I'm into public health and especially into epidemiology, but if there's any other options that I can take into consideration.
Thank you. I got it. I think you are not the first person who has this confusion. This confusion is everybody. I did my master degree. What should I do? I should go for PhD or not? Whether I should go for MSc? That's the valid question. So for me, you should be thinking about your next 5 years plan, next 5 year where you want to go. If you think you want to stay in Canada or work in public health, so you want to do the PhD, you want to be a professor or scholar, then you must go that MSc leading to PhD field. So far I understand, according to the scenario you said. But if I know more detail, your whole resume, then I could suggest you. But for it sounds like Alberta also they have a MSc leading to PhD. Recently, one of my Bangladesh students, she got this acceptance. I think I recommend her to go there. So there is so many MSc leading to PhD. So, but that is the good option. So rather than only MPH and then you are jobless.
Thank you so much. So now we have already extended our program and we have gone beyond our program, beyond our time limit. So I'd like to thank you, Dr. Shafi sir, for everything. And now we have got the last question from our participants here. Then we'll go to Shari Rosen for 1 or 2 questions from the Facebook Live session. So I am going to give opportunity to Amisha Maliha to ask her question very briefly. Thank you.
Okay. Thank you, Tahmid Bhaiya. First of all, hello, sir. I'm Ramisha Maliha. Thank you for the opportunity for giving me to ask you the question. Well, my background was I have done my MBBS from Holy Family in 2017. And after that, I am working as a lecturer. And besides that, I'm currently doing my MPH in North-South University. So my question was, if I do a master's degree on maternal and child health, how is the job opportunity in Canada in this field? Thank you, sir.
Thank you, Maliha. So please hello to Deepokda and Mohammed. So Mohammed also our
sure, sir. Yes, sir.
PhD from Dalla, and Deepokda is our friend long time. And I think North-South University is doing great job. And my student also, now my staff also, I don't know, you know, Dr. Mithila. She's also from North-South. She's my staff now. She's working for me. Yeah. So I think North-South and Bangladesh Medical Bragg, they're producing very good health professionals for public health, at least I can tell. I think there is no limit. You have to stay with the maternal child health. And then once you enroll in the program, the major subject is you have to take 1 or 2 extra course for the specialty of that. Other core component is the same. For everybody learn the biostat, research method, health promotion, all sorts of things. But when you go for maternal child health, then you may take my course or somebody's course. That's all about. It doesn't have to be prepared for that. But if you have any skill, you can transfer your skill to the next project or next level. So that don't be very fixed or rigid on one thing, be open and flexible. So I think the same advice I gave before, you need to prepare your credential. You know, the North-South master degree is not accepted for PhD, so you have to do all over again for sure. And this is the right time to start again for MPH, whatever you may go, not to epidemiology, but go for health promotion or plain MPH, like you can see in the Lana example is a health promotion MPH. So you decide like women's right, women's health, or women empowerment and information power. Kind of, you have to design some attractive topic to convince the committee that you have exciting idea, innovation. So you want to do it during your master degree. Even sometime you can apply for PhD. Sometime, not always. If you have a very good confidence that I learned a lot from MPH degree and I have a clear idea of the design, I have a clear idea of writing, then why not? Because you have a MBBS degree, which Canadians sometimes value as a postdoc. So sometimes they accept, not always.
Okay, sir. Yes.
So that's why I don't want to limit your interest. You just proceed your credential, proceed your IELTS, prepare your letter of intent, get ready your references and submit. This year, almost done, maybe for the September course. Then now you have to prepare for 2022 September. So you have enough time to prepare. By this time, you also will get graduated from North-South University or whatever you're proceeding. Okay,
Thank
but
you,
try to develop your writing skill. You need to feel comfortable when you write. If I ask you to write something, if you feel discomfort, it means you are not ready. So that is the one indicator, like quick acid test. If I ask you write one page who you are and why you want, you need to be comfortable and happy enough to write it down. Once
Sir,
you think you are there, you are ready.
Okay, thank you, sir. And I will convey your regards to Deepak, sir.
Yeah, Deepak is very close to mine. Yeah, they know.
Okay, sir. Thank you.
Yeah.
Thank you so much, Ramisha and Dr. Shafi, sir, for your response. So I would like to, at this time, go to Sharia Rosen to give him the opportunity to ask one or two questions from our Facebook Live session. So Sharia Rosen, you can go ahead. Thank you.
Thank you, my friend, Dr. Thamit, for coordinating and organizing this session. And thank you, Dr. Shafi sir, for making yourself available for such a long time and addressing all the questions we had. So this is amazing. And before, I kind of identified 3 questions from the Facebook Live, as a comment. I'll go through those. But before I do that, I'd like to especially thank Shafi sir for his time. And when I was a student doing my MBBS in Bangladesh back home, I never had this opportunity to talk to or listen to a university faculty from Canada. So this is an amazing opportunity. I'm also amazed how he's kind of answering, how specific answers he's giving to some of the participants where they're trying to, pursue PhD. He's also kind of indicating some name, which is kind of unbelievable. I think this is a great opportunity. But that being said, I think it's also depends on our readiness, whether we are ready to take this kind of help. So even though I didn't have this kind of opportunity when I was back home, I had some opportunity. I went to, so I'm kind of telling a brief story. So when I went to talk to someone I knew, Dr. Roman Raihan from Bangladesh, I wanted to do a PhD. I went to his office and told, I want to do a PhD. How can I do that? He asked me the question, why do you want to do a PhD? I was not able to answer because at that time I didn't know. So that was the end of the conversation. I came back and asked myself, why do I want to do a PhD? And I realized it's mostly because people around me, they value PhD a lot. So I had no idea why I want to do that. So that is the time when I started to question myself. And I'm really grateful to Dr. Roman Raihan for indicating that. I personally mentioned it to him. And I think it was very helpful to me. And also at that time, I was ready to take this help. So I realized that this is a great advice. So we do have lots of people that showed interest to attend this event. And some of them had this, we selected half of them and they had the opportunity to ask those questions. So one advice I would give, it's not about a renowned faculty member kind of solving your problem. It's also your readiness to get this help. So if you think that way, sometimes we think that, okay, sometimes we just look for the shortcut. There is no shortcut to success. So it's not, I am kind of reaching out to someone and he's going to give me the funding. He's going to do it for me. It's more about he's going to show the path to you. Then it's up to you whether you're ready to take the strategy and transform that into action. So again, thank you everyone for attending today. And I'd like to thank again, Dr. Shafi sir. This is amazing that this session is going to almost third hour. So I identified 3 questions from the Facebook Messenger. I'm kind of quickly summarizing those. So one question was about from Saheka, it was about transferring credit. So whether the MPH students currently, whether the students currently doing masters in public health in Bangladesh, whether they can transfer their credit to Canadian university. Another question is about Shara Khurshid. The question is about like, he's a microbiology graduate. He applied for the MPH program last year, got rejected from University of Saskatchewan. So kind of asking advice, what can he do? And the last question is very specific from Fariha. And the question he asked like is about like the Bachelor in Public Health program offered in Brook University that kind of combines with a master's program that can be later on if like there can be some specific advice on that. So just to like combine these three questions, one about like transfer credit, whether it's possible from a master's program for Bangladesh, and the other one is like what to do after getting rejection from a MPH program from Canada. And the last one is about like Brook University. I can repeat those questions later if Dr. wants to.
Yeah, thank you. For me, I think Roselle, you rightly mentioned, it's all about our individual strength. Is not any professor or anybody can do anything for you. Your intention, your energy. Look about Roselle and Tahmid, how successful they are. And they also have a tough journey, like me. Everybody will have a story. Just now is the era of storytelling. Nobody tell the story when we need it, right? So now we are lucky that, thanks God, that we have the opportunity to share our story with you. Maybe in light of in future, next 2 years, 5 years, you will tell your story with other people. That's the chain reaction. So that's, we would like to continue. That's a good thing. Thank you. Second question is the specific MPH course credit. So I think you are thinking too much. Go step by step. First, you need to secure your position in the master program, which university you want to go get in. So once university get in, ask them whether 1 or 2 subjects they can transfer credit. Here is the point I'm telling you. The university degree or university you studied maybe is not even accredited by Bangladesh, what do you call the register agency. Most of the MPH program is not recognized even by the Bangladesh, the government system, what do you call, I don't know, the BMDC?
BMDC.
Exactly. They will not recognize. So imagine if they're not recognized, Canada, no way to recognize. And second is, once you apply for credit transfer, if you study from York University, UFT, other, you can do it. But you need to go to show the link, what subject you study, and how was the evaluation process, what thing you study. There is no curriculum such I can see in any website of Bangladesh of any school. So it's very hard to tell you will get Canadian transfer credit. Is no. My advice is forget about that. Even though you study, you did this, is important for you to learn Canadian way. So if you want to just pass using your credit, actually you are not learning anything. So why are you coming for the degree? So which you are not developing your skill. So I think you should be not focusing on your credit transfer first. Better you focus on your admission criteria, other way how you can develop your admission. Second question.
The second question was about like Shara Khurshid, like she got rejected. Like she's a microbiology graduate. She applied to the University of Saskatchewan, like for the MPH program, but unfortunately got rejected. So she's asking what she should do now. Like,
yeah, sorry to hear your rejection, but you know, failure is the pillar of success. This rejection should not be treated as a rejection. This should be your guiding principle for your development. I think you should revisit your, what I said before, letter of intent, your resume, your reference, your credit very carefully. There is something wrong there. That is why you are not accepted. There is no special intention that they want to reject you due to your background or origin. No, there should be something you need to improve. That is not a rejection. I think this is the better guiding tool for your development. You developed and then apply again. I don't see any is a rejection. And even I run the program at Ryerson, hundreds of people apply, and then only 25 people I can accept. and they keep applying. Even this time I got 7 times she applied, and she said, I don't want to give up. So you could imagine, if you have a passion, you never give up. That is not a rejection. That is just beginning of your learning. Take it as a learning curve, that what missing piece, you need to fix it. And I would love to see your letter of intent, your resume. Then I can tell you so why you are not accepted at that time. Okay, I don't think anything to blame. Just you need to just improve. They want more better quality from you.
And the last question we have is from Fariha. It's kind of very specific about Tobruk University, and she's interested to know about like the Brook University's Bachelor in Public Health program that is like combined with a master's program in Ontario later on. So if we know anything about this program or can get back to her later on, she was interested to get some insight about it.
Yeah, send me email. And I know not only Brook University program, I know Brook University president. My friend Garvin Ferron is the university president. So I know the program fully, thoroughly. And it's very good university and very, very nice program. You should think about. Many people don't know. We have a university in Niagara, university in Brook, University of Ontario, you have UIT, University of Windsor, University of Waterloo. We have so many. People only biased on UFT or Ryerson or York. So we have lots. You need to pay attention based on this. So I think you should go ahead, and if you have any specific questions, send me email. I can tell you.
Thank you, Dr. Shafi sir. Like these are the 3 questions that I kind of identified from the Facebook Live. And there are like other questions, but a lot of other questions that already been covered. So, and I'll give the floor back to Thamit. But before I do so, like I'd like to thank you again. And I personally find storytelling very powerful. Sometimes I go out for coffee chat with our senior officials, like where I work in the Ministry of Health. And I just ask for their story because this is how I learn best. I think stories are very powerful and a good tool for learning. So thank you so much for taking the time to share your stories and answering the questions. And back to you, Thamit.
Thank you so much, Dr. Rosen. And we have come to the end of our today's special session. So I'd like to give the floor to Dr. Supriyo to do the event closing. Thank you.
Today, I and all of us are very much lucky to have a discussion with you, sir, with you, Dr. Shafi, sir. I'm really feeling very lucky and honored to host this session with a leader like you. I was a bit of nervous when I heard that this session would be totally in English, but I want to give a special thanks from the core of my heart to Dr. Shafi Bhuiyan, who is the organizer of the today's session, to Dr. Ryerson, who motivated me to do this. And lastly, we didn't mention his name that much, Dr. Nazib Mahmood Bhaiya, today who has given the entire tech support. Now it is time to end this brief discussion, and thank you very much, Dr. Shafi Bhuiyan, sir. Thanks a ton from the core of my heart. I and the prospective students are more than are very much lucky to get the knowledge and the information from you, and you have shared your career journey, the pathways and the opportunities. It was so unbelievable, and I'm sir, I am feeling very lucky, and thank you, sir. Thanks a ton.
So I would like to say a few things before if I may. Can I say?
Yes, sir. Obviously, sir.
Okay. I think it's very humbling experience to know so many young professionals from around the world. As you know, I'm very lucky that last couple of years, about 50 countries, medical doctors I trained among thousands of doctors, like 255, 275 doctors I trained and mentored, and all are successful. And I see there is no reason these people cannot be successful. I learned hard work is matter, but not enough. I learned we must work as a smart and strategic way to be successful. And this is a journey. This is not one short event. So don't give up. I am very humble that I learned a lot of things from you. As you know, due to system issue, many talent we are missing, many untapped people, untapped resources in Bangladesh and around the world, and we want to explore. I thank the CRIDA to connect me with these brilliant people, brilliant mind, brilliant heart, and I'm humble and thank to the team to organize your dedication and the talent you help support. You would like to help support other people. That resonates me, as I said. Helen Keller said, "Services to others is should be our meaning of life." And in this COVID situation, everybody has a lot of pressure. Last 3 hours look like a three minute I talk. Usually the times is boring, right, in the midnight. But now you could imagine we speak last 3 hours, but look like 3 minutes. So our journey is just started, is another phase of your life. Just keep in touch. I found great excitement and privilege to scope and work with you people in this unsettling time. Yes, your dedication, your cooperations matter to help shape our country health system and good, better life of our people. I am very proud to thank today's the back that Najib is extraordinary slight development for us. And I also welcome, I share my email address and WhatsApp number anytime. 24/7, 365 days, you can reach out to me. But don't be upset if I not respond to you immediately, but a couple of days later, you can remind me. So whenever I have time, I will definitely respond to you. But please remember how to write email is important. If what you're asking for, you need to be clear. You need to tell me who you are, what you want, and how I can help you. So 3 paragraph at least, so that I can respond to you. Okay, this is from my experience. Sometimes you write many big email, but I cannot find what actually I should do. I should be doing for you. So be precise, be brief. What the way you learned today from the presentations and the and all this structured by Tamid and his group and Rosen. So this is very good learning experience for you from the beginning to the end. I wish all you good health and take care of family. Enjoy your time. Every moment is important. Remember, life is not a is one time. Enjoy it today. It's not in a rehearsal. It's final. So you have to enjoy every day. And you can see, you can follow me in Twitter and LinkedIn. You can see me. I enjoy every moment. I love people and I would like to connect to you. Thank you all.
Thank you so much, sir. So I'd like to thank you, everyone. So it's been a pleasure to organize such an event. And I'd like to thank our speaker, Dr. Shafi sir, for giving us his valuable time and guidance. So here is my actual reflection of Dr. Shafi sir. I didn't know him before, but I just got to know him within like 2 weeks. And I can just say, like, when I'm comparing the assistant professor or the assistant scientist from ICDDRB or Dhaka Medical College, I can definitely see how much cooperative and supportive he is. And I don't feel nervous. Like I used to feel nervous when I was in Dhaka Medical College or ICDDRB to ask a question or to seek for guidance or something like that. But Sir is very, very cooperative, very friendly, and kind of gives suggestion or advice to the point. Thank you so much, sir, for your time and guidance. And I look forward to working with you in future. And Dr. Rosen for overall coordinating the event. Thank you, Dr. Shukriya, for hosting, and Dr. Nazif for providing technical support. Last but not the least, I would like to thank all our participants who have joined us directly, as well as our Facebook viewers for patiently watching our live program. At this time, I'd like to remind you, if you haven't joined our Facebook page and our group, so CRIDA and Public Health Education Career, we have one group and one page. So you are encouraged to join to know more about our next events and initiatives. And I would like to remind you, our participants who have joined directly in a Zoom session, that we will be sending an evaluation form shortly, and would really appreciate if you can complete the form. It would help us to better organize and coordinate our future programs. And lastly, best of luck, everyone. And I wish you all good night in Bangladesh and a very good morning in Canada. Thank you.
Thank you.